We're going to be doing a cystocentesis today, so we are going to use an ultrasound, but first we're going to feel and palpate our bladder and isolate it. She has a moderate size bladder, but because she's had stones, we do want to use ultrasound to check for that. So we'll go ahead and put some alcohol in our inguinal area. And then we'll use our ultrasound probe to locate our bladder. And then we have our 5cc syringe with our 22 1.5 inch needle. So we'll go ahead and insert that in and withdraw our sample. So here is our sample here of our urine, and we're going to put this into a plain red top tube so that it can be sent to the lab for evaluation. So we'll go ahead and put our urine in. And then what we'll do is we'll write our patient's name on the outside of our urine and today's date. So we're getting ready to do our urinalysis. We've collected our sample via cystocentesis from our patient. We have our patient's name, today's date, and what our sample is labeled. We are going to go ahead and observe the color clarity and do our specific gravity first. So this urine sample does have a little bit of an odor to it. It is a darker colored yellow. It is not clear. It is rather opaque. So we are going to be checking for evidence of infection in this sample. So the first thing that we're going to do is our specific gravity with our refractometer. We're just going to take a small drop of our sample and place it on our refractometer. We're going to close it and then look up towards the light to read. And this one is reading as a 1.020 reading. And so we'll go ahead and note that. So we will clean this with our chem wipe. Next, we are going to be doing our reagent strip here. So it came from this bottle here. So we're going to do 1 drop on each of our little squares and then let it sit for 60 seconds. Okay. While that is sitting, we will go ahead and begin to spin our sample in the centrifuge. So we will balance it. Take out this. We will balance it with this balance right here. So we'll just put them across from one another. So in 4 and 1 in our centrifuge. And we're going to set it to spin for 5 minutes. And once this is done spinning, we will go ahead and read our sample. So right now, we're almost ready to check and read off of our bottle here. So we'll go ahead and denote on our sheet here. So we'll match them up on our bottle. And since we read the specific gravity, we're going to ignore the bottom one. So we're going to look at pH, which is 9 on here. Glucose, which is negative. We're going to look at protein, which is looking to be 100 plus. We are looking at bilirubin, which is normal, and ketones, which is negative, and then blood, which is trace, and those are going to be milligrams per deciliter, except for pH, and so we're going to go ahead and record those values, and then once this is done spinning, we will read our sample. So our sample is done spinning, so we'll go ahead and remove it here. We are going to pour off the excess of our sample, leaving a small amount in the bottom of our tube here. So we're going to make 2 slides, a stained and unstained. So we're going to pull a small amount of urine out of the bottom of our tube and place it on the slide. And then you're going to put a cover slip over that one. And that is going to be our unstained sample. And then we're going to place a small drop of our stain in our tube here. And then we are going to take a drop of that stained urine and place it on our slide as well. And then we're going to put our cover slip on top of our stained sample. And so we will just label them stained and unstained. And we'll want to put our patient's name and the date on there as well. So we're going to read our stained slide first. Okay, so we're going to make sure that we are focused. And start at the top corner of our slide and work our way across. We're going to go down to our 40X. Okay, and so we're looking for evidence of infection in this patient. So red cells, white cells, we're looking for casts, crystals, and we're going to make sure we scan our slide thoroughly. I'm seeing evidence of bacteria. It looks like there are rod-shaped bacteria present, quite a large amount. I'm also seeing white blood cells. Looks like there are a couple per high-powered field. So far, I'd say 1 to 2. But we'll read our whole slide first. I'm also seeing an occasional red blood cell, but not on every slide here. So far, no crystals. And our white cells and red cells are taking up our stain here. So they're easier to spot. I would definitely say they're too numerous to count rod-shaped bacteria on this slide. So it looks like there's definitely evidence of infection. I'm not seeing any casts either. Okay, so it looks like we reached the edge of our slide, so we'll go ahead and record our results here. So I'm going to say too numerous to count rod-shaped bacteria, and then I would say 1 to 3 white blood cells per high-powered field, and then 0 to 1 red blood cells per high-powered field. And so we'll record that in our patient's chart, and we are done with our urinalysis. So here is an example of red blood cells on a stained urinalysis. You can see that they have a central pallor, so right there, and those are present with signs of infection. You'll often hear clients say that they see blood in the urine, and then when we do a urinalysis, this is what we find. So that is one of the many things that we can see on a urinalysis. Another type of cell that we can see are white blood cells. Those are going to be larger than red blood cells, and they are present with signs of infection as well. So a urinary tract infection, bladder infection, those can be present in urine samples of those type. And there are a couple examples on this slide. So here are the arrows pointing to the example of a white blood cell. Another example of something seen in a urinalysis are casts, and there are several types of urinary casts that can be present. In general, hyaline casts, cellular, granular, fatty, and waxy casts can be present. So these are just pictures of waxy, and this one over here is a granular cast. So cast are usually related to the pH of the urine or concentration of the urine, and form in the absence of cells in the tubular lumen. So here's an example of struvite crystals. They can be seen with the presence of bladder stones. So a lot of patients that have struvite crystals will often have stones as well, and whether or not they have to be surgically removed just depends on the size and number of stones and the difficulty that the patient is having at the time. So these crystals are related to the pH of urine, and here's a good example of one right there. Another type of crystal is going to be calcium oxalate, and so they are generally smaller and they are more square. So there's an example of several calcium oxalate crystals in urine. And lastly, we will talk about bacteria that can be present in a urinalysis. So on the left is cocci. So they are smaller, more circular shaped bacteria. And then on the right we have rod shaped bacteria. And they are just two different types that can indicate infections going on in urine. In the patient that we did the cystocentesis and urinalysis on, we did see the rod shaped bacteria that was present, so similar to the picture on the right for this particular patient.